Hi everybody, my name is Gabriel Mioto and I will talk about strategies for psychomotor skills learning. I will show you the main factors that influence psychomotor skills learning, such as the nature of the skill, procedural rules, kinds of practice, feedback, and assessment. Let's start with the question, what characterizes psychomotor skills learning? As the word says, it is the acquisition of a skill that involves cognition and learning new coordinated muscular movement, like for example surfing, performing a surgery, or driving. Surfing and performing a surgery have different starting and end points, different interactions with the environment where they are performed, and different association of movements. When considering a psychomotor skill instruction, start by identifying the overall nature of the skill. The next factor of psychomotor skills learning is the procedural rules. When we explain and demonstrate a skill, we show the executive subroutines involved in the task to the learner, the steps of the skills that are organized, and then create the whole task. It defines the cognitive part of the task. We learn what to do and in what sequence, but with no physical action yet. That comes next with practice. Practice leads to temporal patterning, which means the development of pacing and anticipation of movements. The theoretical knowledge from the procedural rules is then associated with movement. We learn how to do it in a coordinated way. The more we practice, the more the skills become automatic and proficient. Practice is classified according to distribution and chunking. In mass practice, the learner engages in one or a few intensive extended periods of practice, and in spaced, there are many relatively short practices distributed over time. A whole practice is the practice of all the components of the skill at once. Now, part practice emphasizes on learning separate parts of the skill that can be further integrated in a sequential way. But most important thing to define which kind of practice is better is by knowing the learner and the nature of the task. As an example of practice distribution, propose a shorter and more frequent practice if the task is simple, repetitive, and needs concentration, or your learner is immature or distracted and fatigues easily. An opposite scenario will require a longer and less frequent practice. Now an example of practice chunking. Propose a practice of the skill as a whole if the task is dependent on integrated, simultaneously performed parts and is simple, and when the learner can remember sequences, focus the attention, and is skilled. The opposite scenario will require a different chunking. Being attentive to the learner and the learning task will help you define the best combination of practice. Regarding feedback, two kinds are important in a psychomotor skills learning. Internal or proprioceptive feedback, which comes from the learner's senses and is developed with correct practice, and feedback from the instructor about the final product or about the process of getting there, which is most important for beginners. The final factor to consider is assessment. It should evaluate cognition and the motor part of the skill. Checklists and rating scales are the most used tools for those purposes. In summary, we can use the factors involved in psychomotor learning to organize the following strategy. Prior to practice, it is time to define the skill and its procedural rules, get knowledge. During practice, it is time to work on procedural subroutines, associating knowledge with the motor action. And after practice, we use feedback and assessment to evaluate learning and proficiency. That's all. Thank you.